Colds and coughs are very common during this season, especially between June, July to October, November. We expect children to have at least one episode of cold and cough per month. This is very common, and during sometimes it is twice a month also. The frequency increases because there are 2-3 reasons. First thing is, whenever there is a rainfall, the humidity level usually will be very, very high. So what happens, we tend to close our windows. There will be a lot of viral proliferation. The virus keeps on multiplying around us. This itself causes a lot of contagious diseases from one person to another person. So immediately there will be increased incidence of your respiratory flus, your respiratory viral infections, which itself results in colds and coughs in these children, which will be associated with fever, and usually these type of infections subside within 5 to 7 days. So you can have colds and coughs during this season majorly because of viral infections, which is very common to have different viral infections every month for these 4 to 5 months. Then the child will be absolutely all right. And it is okay to have these episodes during these periods. And it is not that difficult to manage these episodes. And there is also another type of cold and cough which stays there for days together in an otherwise healthy child. Child is absolutely healthy, but the moment he gets up might sneeze continuously, or moment the child comes out of the house might sneeze continuously, or go to certain place might sneeze continuously, or might have severe running nose, itching of nose, associated with throat irritation, associated with cough which increases at night or when the child is running or sleeping. These kinds of running or jumping, so these kinds of colds and coughs are called as allergic colds and cough, and this condition is, if it is in the nose, we call it as allergic rhinitis. If it is occurring in the lungs, we call it as asthma. So my dear parents, what we need to remember is differentiate the regular colds and coughs from infectious colds and coughs. In infection, usually these colds and coughs are associated with fever, which will be there for 4 days and then subsides, and this entire cold and cough episode subsides within 7 to 10 days. If a child otherwise is healthy but is having continuous running nose beyond 10 to 14 days, also is having cough intermittent during certain periods of time, but the child is otherwise very, very healthy, consider it to be a cause of allergy. It can be an allergy of the nose resulting in allergic rhinitis. It can be an allergy of the lungs, which results in swelling of the windpipes resulting in a condition called as asthma. Because the child might not be having any breathing difficulty, but the child might have continuous dry cough. That is something which we need to keep in mind. And if we treat it on lines of viral infection, or we keep on giving antibiotics unnecessarily to these children, the children might suffer more. It is better we get the child assessed. And what we can do in house as far as regular coughs and colds associated with viral infections are concerned, there is nothing much. We need to give a symptomatic treatment for this child. Just a saline drops in each nostril, which are easily available, little bit of steam inhalation. Let the child take warm soups and liquid most of the day. That keeps the throat hydrated, the throat from being irritation. That itself will subside most of the problem. Let the child sleep on side on position or in prone position, so that the child doesn't have a post-nasal drip cough. What is post-nasal drip cough is the secretion from the nose settle on the throat, and the child is absolutely fine with severe running nose. The moment you make the child sleep, the child starts to have cough. So we can avoid these situations by doing this, and keep on giving him warm water intermittently. That actually helps. And a lot of home remedies can be tried in house before we think of giving syrups which are prescribed by pediatricians. So home remedies which we normally popularly recommend is warm water, 1/4 glass warm water with 1 spoon of honey, 1 spoon of ginger is actually good enough. You can add a little bit of tulsi to it if you want, but these things actually help in clearing the throat, acts as an excellent cough syrup remedy in your house. And if you are non-vegetarians, you're okay with it, little bit of egg whites with pepper and salt also helps as far as soothing and calming your throat, calming our throat is concerned. So a lot of remedies which are present in house which can be safely given to the child, especially during cold and cough. Other than that, we can prescribe give prescription based on our pediatrician's advice.